Good morning to one and all. Today my topic is about injury and epidemiology. Our group members are Anisha Meedi, Kaushiki Oja, Joseph Dixon Paul and Helly. Epidemiology. It is the study of the impact of the disease injury on the population. This includes an examination of distribution of injury and illness as well as an assessment of risk factors that contributes to health problem. An epidemiologist model that takes into an account the host, the agent of injury or illness by the factor of injury transmitted readily used in the study of injuries and violence.
Hello, my name is Kaushiki Oja and I'll be taking the presentation forward. So let us know what injury epidemiology actually means. As of today, injury epidemiology pertains to the study of the distribution and determinants of injuries and safety related states and events in specified population as well as the application of findings in order to prevent injuries and promote safety. Let us have a look on the theoretical definition. A clear definition is essential in pursuing the etiology of any given pathological entity. Thus, it is also essential to name contemporary terms used in order to best describe the content and the essence of this discipline. As of today, injury epidemiology pertains to the study of the distribution and determinants of injury and safety related states and events in specified population as well as the application of the findings in order to prevent injuries and promote safety. Now let us look at the second topic, which is traffic crash injuries. Road traffic accidents are one of the most common causes of death and disabilities, especially among young people. Young people, male alcohol or drug consumers, and users of cellular phones are all more likely to be involved in a road traffic accident. In addition, various characteristics of the vehicle and road conditions may interact, and with the above human factors to be increased the prevalence and severity of road accidents. Studies have shown that simple preventive measures such as the use of seat belts, airbags, and reduction of speed limits can help to reduce the prevalence of death and injuries due to traffic accident. Here is a graph which shows the sex-wise road accident death by type of vehicles during 2008. Now that's all about my part. Thank you.
Risk factors. Socio-economically status. More than 90% of road traffic deaths occur in low and middle income countries. Road traffic injury death rates are the highest in African region and lowest in European region. Even within the high income country, people from lower socio-economic backgrounds are more likely to involve in road traffic crashes. Risk factors. Age. Road traffic injuries are leading cause of death for children among adults aged 5 to 29 years. Sex. From a young age, males are more likely to be involved in the road traffic crashes and females. About three quarters, 73% of road traffic deaths occurs among the males under the age of 25, who are almost three times as likely to be killed in a road traffic crash as young females. Risk factors. Speeding. The safe system approach to road safety aims to ensure a transport for all road users, such as approach takes in the accounts people to serious injuries in road traffic crashes and recognize all human error. The cornerstones of the approach and the safe roads and roadside safe speeds, safe vehicles and safe road uses, all of which must be addressed in order to eliminate fatal crashes to reduce serious injuries. Risk factor reduction. Safe system approach. The safe system approach to road safety aims to ensure a safe transport system for all users, such as approach taken into the accounts people to serious injuries and road crashes, that the system should be designed forgiving of human error. The cornerstone
Thank you, Koshiki, for the previous part of this video. Now I will proceed with workplace injury. Hazards in the workplace: construction workers are most at risk for fatal falls from height, more than 7 times the rate of other industries, but falls can happen anywhere, even at a desk job. Whether working from a ladder, roof, or scaffolding, it's important to place ahead, access the risks, and use the right equipment. First, determine if working from a height is absolutely necessary or if there is another way to do the task. On the right side of the slide, we can see the number of cases of non-fatal occupational injuries for industrial with 1 lakh or more cases in 2002. That's it. Now let's proceed to the next slide. There are types of workplace injury, which is fall and other traumatic injuries, repetitive motion injuries, chronic exposure conditions, psychological and emotional trauma. Now we can see the common causes of workplace injuries, which is defective or hazardous equipment, motor vehicle mishap, insufficient safety guidelines, insufficient training, reckless co-worker conduct. In the next slide, we can see the data of workplace injuries, which is number A: slips, trips, falls, overexertion, bodily reactions, and contact with objection and equipment account for more than 84% of all non-fatal injuries involving days away from work. About 2.3 million people worldwide can have work-related accidents every year. There are about 340 million occupational accidents and 160 million victims of work-related illness annually. 40% of all occupational fatalities in 2019 were attributed to transportational incidents. And Latino workers experienced 3.7 fatal occupational injuries per 100,000 workers from 2018 to 2020. 20% of worker fatalities in 2019 in the US private sector were in construction. Now in the next slide, we can see how to reduce workplace injury. Number one is safety should be the number one priority. Hiring, telling employees about the importance of safety when they start. Educating, which is workers about safety measures and the importance of following rules. Training, properly train workers for new job duties. Monitoring, make sure employees properly follow all safety procedures and correctly use equipment. Enforcing interior consequences for failure or to follow safety measures. Now, there are also more to how to reduce workplace injury. Discussion, talking about safety all the time at staff meeting, performance evaluation, assessment, job requirements. Placement, providing, reviewing injuries, identifying weaknesses, reviewing workplaces, and rewarding. Now, there is also providing proper training and safety weaknesses, which is like cuts to the hand or thumbs make up several of the most common work injuries in Vermont. These figures point out a need for greater use of safety gloves and everything that goes along with them. Glove availability, required use, education, training, supervision, consistent enforcement, etc. Now there is also reviewing the workplace practices, which is like common work practices may lead to the work injuries, considering the use of overtime work for strenuous or repetitive work. Adding overtime hours can only compound overuse. Hiring staff or part-time staff may actually reduce or overexertion injuries. Staffing level may similarly impact injuries, where when a large job requires several workers, insufficient staffing can encourage workers to do more than they safely should, resulting in injuries. That's all from my side. This is me, Anisha, and I will request my fellow batchmate to proceed with the rest.
Hello, my name is talking about violence and suicide. The introduction. The Violence and Injury Epidemiology Unit aims to improve population health by reducing the morbidity and mortality from unintentional and intentional injuries. By looking more closely at the nature of acts of violence, these three categories can be further divided into four more specific types of violence: physical violence, sexual violence, psychological violence, and neglect. The incidence of suicide in a society depends on a range of factors. Clinical depression is an especially common cause. Bullying can also drive people to suicide as it increases social isolation. Substance abuse and severe physical disease or infirmity are also recognized as causes. Now, coming back to some statistics, there is one suicide death in the US every 11.5 minutes. Suicide is the third leading cause of death for 15 to 24-year-old Americans. The highest suicide rates per 100,000 in the US are among white males, which is at 25.4%, followed by Native American or Alaska natives at 14.6%, and black males at 12.6%. Here you have the epidemics of suicidal behavior. There are two basic types of epidemics or clusters are known to be related to suicidal behavior. The first is point clusters. Point clusters are a series of suicides or suicide attempts that occur closely within a period of space and time. These clusters are commonly investigated and often involve the interaction between at-risk persons and an immediate onset of a localized exposure. So this means to say that in point clusters, there is an involvement of people who are have a suicidal behavior, and they are accompanied by a person who has been already exposed to that kind of a situation. In mass clusters are widespread geographically but grouped closely in time and are believed to be associated with widespread exposures. Here we have another statistic which talks about during January 2004 to December 2007, the suicide rate in a rural community increased from 12 to 141 deaths per 100,000, and the population and suicide attempts increased from 273 to 967 per 100,000. These could be related to a lot of factors that have been talked about earlier. And it could be bullying, it could be depression, it could be other issues that the people face that lead them to take their own lives. Next, we have the public health response, where it talks about the CDC's field investigation found that risk factors for suicidal behavior included male sex, that's death only, and adolescent or young adult age, gang activity, physical or sexual abuse, mental health problems, substance abuse, and domestic violence. Suicide by hanging was overrepresented, and first attempts by persons who recently had a friend die of suicide increased exponentially during this period. And residents believe the onset of behavior coincided with the activities that glamorized the suicide deaths. So this point talks about how there was an investigation done by CDC and how they categorized why the reasons for the death of the people and why people were committing suicide. The take-home point of violence and suicide is suicide can cluster and spread throughout a community through social contagion, and persons with multiple risk factors are particularly vulnerable to this social effect. Field investigators identified the mechanism of venues driving the social contagions and used that information to help stop the spread of suicide. CDC worked with the community to change the messaging about suicide toward how to seek help as a preventive intervention. This talks about how CDC helped people ask for help when they were in need, and they set up hotlines to help them understand the situation better. Epidemics of homicide and non-fatal interpersonal violence. Similar to investigations into suicidal behavior, homicides and non-fatal forms of interpersonal violence can cluster and be linked to exposures that lend to intervention. When field epidemiologists work with law enforcement officials, the role of field epidemiology is to focus on preventing future injuries and deaths by identifying at-risk persons and relevant exposures in need of immediate public health action. For example, identifying and arresting a homicide perpetrator on a killing spree in a community can sometimes be being a long process and not a feasible short-term strategy for intervening on the violent outbreak. However, field epidemiologists can use public health methods to identify ways to protect community members from being victimized by the perpetrator. We have another statistic where it talks of how during July 1st, 1979 to March 15th, 1981, 22 unsolved child homicides and 2 child disappearances occurred in Atlanta. This talks about how a community is affected by uh, violence, and how when there is a serial killer around, uh, and when there are unsolved mysteries, the people who are involved and the families involved do not get justice, and they do not know what happened to their children. The next point is public health response. In CDC, field investigators conducted a case comparison analysis of the victims and a case control study comparing victims with other children in the community. The victims shared similar characteristics that were distinct from other child homicide victims. These findings suggested that deaths were a discrete cluster. Case children were more likely than control children to run errands for money and spend time alone on the streets or in shopping centers, which suggested a single perpetrator who was local and knew the children were approachable. The take-home point is field epidemiologists helped law enforcement by determining that case children were part of a unique cluster. The deaths were most likely linked to the same exposure, and specific factors placed the children at risk. The public health approach also informed local residents about measures for protecting the children. Homicide and assault outbreaks also result from gang activity, gang-related homicides and assaults. All the field epidemiologists might not be able to immediately rid a community of gangs. They may be able to identify locals with escalated gang conflict and provide information to public. Such programs include those that Cure Violence model. This model recruits former gang members and other community leaders who are respected among gang members to resolve gang conflicts peacefully. A future growth area for this program involves leveraging epidemiological analysis to better inform and target the efforts of Cure Violence interrupters and other staff members who interact with the communities they serve. Thank you, and that was my part, and I would like to hand over the opportunity to the next team member.
Hello everyone, my name is Ali Lalakia and I will continue with the topic Public Health Problem. During July 1, 1979, March 15, 22 unsolved child homicides and 2 child disappearances occurred in Atlanta. Public Health Response. Public Health Response. CDC filed, investigators conducted a case comparison analysis of the victims and a case control study comparing victims with other children in the community. Victims shared similar characteristics, for example, young children, male, overrepresentation of death by asphyxiation, etc., that were distinct from other child homicide victims. These findings suggested the deaths were a discrete cluster. Case children were more likely than control children to run errands for money and spend time alone on the streets or in shopping centers, which suggested a single perpetrator who was local and knew the children were approachable. Take home point. Field epidemiologists helped law enforcement by determining that case children were part of unique cluster. The deaths were most likely linked to the same exposure. The public health approach also informed local residents about measures for protecting children. until an arrest could be made. Homicide and assault outbreaks also can confirm gang activity. Gang related homicides and assaults can spike when rival groups and or gangs engage in conflict and retaliation. The Cure Violence Program members who conduct these actions are called the interrupters. A future growth area for this program involves leveraging epidemiological analysis to better inform and target the efforts of Cure Violence Interrupts and other staff members who interact with the community they serve. Let's conclude our whole topic. Analysis of secondary datasets revealed that most of injured individuals are young and male. There is no seasonality, but more reported injuries occur on Sundays and during daytime. Transport injuries and falls are the top causes of injuries in the Philippines. Results have implications in health policy and injury prevention. Mapping helped identify provinces with high injury rates. Injury categorization identified common injuries that should be considered in capacity building of healthcare providers. Strengthening data systems will likely yield better data and allow more precise policy recommendations. Thank you. Now let's summarize our today's topic. As the basic science of public health, epidemiology includes the study of the frequency, patterns and causes of health-related states or events in populations and the applications of that study to address public health issues. Epidemiologists look at differences in disease and injury occurrence in different populations to generate hypotheses about risk factors and causes. They generally use cohort or case control studies to evaluate this hypothesis. Knowledge of basic principles of disease occurrence and spread in population is essential for implementing effective control and prevention measures.